good afternoon, guys. My name is Han from Crucial Rehab, and we also have Chris.
Hi everyone, my name is Chris and I'm a physiotherapist from Crucial Rehab.
Yeah, so both of us are actually physiotherapists at Crucial Rehab. We see all kinds of cases, stroke, right?
Yes.
Sports injury.
Yeah.
But today our topic will be more of
Stroke.
So we are going to speak more about stroke today.
So before we go more in depth into stroke, let's just share a little bit on what stroke exactly is. Stroke is a neurological condition where there is a lack of blood flow and hence oxygen to the brain cells in our brain. There are two main kinds of stroke, namely ischemic and hemorrhagic. So ischemic is where there is a blood clot in the blood vessel causing a blockage and hence lack of oxygen to the brain cells, causing the death of the brain cells. And hemorrhagic is where there is excessive bleeding from the blood vessels, hence also preventing blood flow to the brain cells. So there are these two main kinds, but there's also a third kind of stroke, which is known as transient ischemic attack, which is more of a temporary stroke because symptoms don't last more than 24 hours.
24 to 48 hours.
Yeah.
So you are saying that stroke is because of the occlusion of the blood supply to the brain, right?
Yep,
But
correct.
what causes all these things to happen?
Okay, so many things actually. There are two main lists of risk factors, namely the ones that we cannot control and risk factors that we can actually control. So let me just talk about the ones that we cannot control first. So these include our age. So there are studies that show that as you grow older, there's a higher tendency of getting a stroke. And also in terms of gender, studies have also shown that there is a ratio of 1.4 to 1 for a ratio of male to female. That means male have a higher chance of getting a stroke.
There's a hereditary component in
Yes, correct. So that's the third non-controllable risk factor. So if
your family members had
a
history of stroke,
you're more likely to have one. Just more likely, not
more
necessarily.
likely.
Yeah, so things that we can change include our things that involves our lifestyles. For example, smoking, drinking, high blood pressure, diabetes, and also high cholesterol. So these are things that we can actually control in our daily lives in terms of diet, in terms of whether we exercise or not, our sleep, and our stress levels. So if we are deprived of sleep and we are stressed at the same time, naturally our blood pressure will increase, and this would naturally increase the risk of stroke.
You were saying food and nutrition, right? What are some tips, that can help reduce the risk of stroke?
So as I mentioned, high cholesterol and diabetes are also two of the main factors, risk factors that can cause stroke. So by reducing your amount of sodium or your amount
That
of
would be
fat in
salt,
the food,
right?
sodium is salt, amount of fat, and also your level of sugar in your drinks, in your food. It may seem very subtle or very little with each mouth, but as days goes on, it will affect your body greatly.
So having more vegetables, less meat items, right? Red meat items, more fruits.
Yeah, more fruits, fiber, so on.
So we already said about the cause of stroke, what is stroke. So what happens if, one day that one of our family gets a stroke, then we are at his side, what should we actually do actually?
Well, so I think you're asking about what are the signs that we can look out for
Yes.
for someone who might have a stroke. So there is actually a phrase where you can remember very quickly, which is be fast. B for balance. So if someone actually loses balance in front of you or they suddenly fall off their chair, it's one of the symptoms. E is for eyes. So if they are complaining of blurred vision or they are seeing doubles, it's another possible symptom. F is face drooping. So if you notice that one side of their face, their mouth is falling, or they are unable to control it, that's also one of it. A is for weakness in the arms or the whole side of the body, including the legs. S is for speech difficulty, if they are not able to pronounce things properly or their words are incomprehensible. T, so with all these symptoms in hand, and the final one would be time, which is for you to call the ambulance or send them immediately to the emergency ward to check out whether it is actually a stroke.
So timing is very crucial in
Yes,
terms of
time is of
stroke.
the essence. So the longer you take to get them checked out, there might be more damage caused to the brain as time is increased. Yeah.
Speaking of time, I've actually heard of something, the term as a golden period for stroke, right?
Yes.
What is it?
So we as therapists, we would normally tell people that the first 6 months after a stroke is the golden period. Why we say that is because during this period of time, it is where most recovery of movements or the muscle tone would slowly come back in a patient. So it is also the time where we push the patient to do more movements, and it's more crucial for us to get them to recover as quickly as possible.
I see. So speaking about recovery, there is definitely a role in what the hospitals do, right? The
Yeah.
multidisciplinary
Group,
team of the doctors, the nurses,
occupational therapists,
occupational
speech
therapists.
therapists.
Yeah. How do the physios come in to play their role?
So you can think of physios as movement specialists. So mainly what we help with is to get them back into moving, get them back. So whatever you do in your daily lives, you require movement. Even just by drinking this cup of water, you require your arm to hold it and bring it up to your mouth. So we prescribe exercises to help them to regain all this movement, and this requires a lot of assessment, detailed assessment to understand their condition and their situation better before we prescribe anything for them to do. So it's different for every individual because it depends on the level of severity and the level
The symptoms that they have.
the
right?
symptoms that they have, and yes, so the level of functional abilities that they come in with. So all these we take into serious
So
consideration.
functional independence in the term is like dressing themselves, eating and stuff.
Yes,
So
bathing.
a physio, bathing. So a physio actually assesses all these activities.
Yes. So we would first start with the basics, like whether they can move their arms, they can move their legs, whether they can walk, and then eventually by checking all this is to see whether they are still functional in terms of like what Hans mentioned, whether they're able to feed themselves or they are able to actually use the bathroom on their own. So our final goal is to get them to be independent again, to get them to their normal lifestyle or things that they have been doing before the stroke.
But those are activities, right? Like I would also say as a physiotherapist, the big movements are like bed mobility, a lot of walking, standing, balance and all, right?
Yeah, so before they do more advanced stuff, I would say that our basic assessment and our basic prescription would be for them to first move in the bed, move on the bed. So then this is to also prevent pressure sores from happening. Pressure sores are where wounds would occur if you lie too long on a certain area, and the skin and the flesh would rot, and eventually will cause a lot of secondary complications such as infection, so on and so forth. So yes.
Okay. Speaking about stroke, how does the physiotherapy come into play then other than assessment, How do we help improve in activities and
So
stuff like that?
we assess and then we prescribe a lot of exercises. Or in terms of movement, we get them.
So let's just say for an
Yeah.
instance, we assess a patient and we notice that they have an inability to walk. Then how do we progress from there?
Okay, so
There are reasons, right, why they
yes.
cannot walk.
there are reasons. So that's why an assessment is important because we need to know. So when you're walking, you need to get your legs moving. You need to make sure that you're balanced enough to do that. So
Your
things
muscles
like
have the strength.
your muscles have the strength, you have actually the range to move forward. So some people can come in with very tight joints, very tight muscles because of lying for in bed for too long, so they can get very stiff. So
There's something in
this is
stroke that
affected.
they call muscle tone also, right?
Yes,
Explain more about
correct.
the muscle tone.
Muscle tone, we call it hypertone. Basically, it's an increased tone in the muscle. So if like for us, we have normal tone. An increased tone would present itself with movements like this. So if you see a stroke patient walking like this, they might most probably have an increased tone in the arm, which is not something that they can control.
So increased tone is basically the muscle being become extra tight, right? So movement is very limited. Other than hypertone, I think some strokies come in with what we call a hypotone also,
Yes,
right?
so you will see two different extremes. You will see someone coming in with very tight joints and muscles, but you also see someone with completely limp arms and limp leg. So
We call them flaccid legs,
flaccidity, yes, in the muscle.
where I think in this stage would happen a bit in the beginning, and there is a lot of weakness, right?
Yes, some come in with zero movement at all. Yeah, with no movement at all.
So other than this, I've also heard that some stroke clients, they do have pain in their shoulders, sometimes in their hips. Why does this happen?
So there is something that we look out for when we check the shoulder, which is called the sulcus sign. So it is where it is palpable. That means you're able to feel it. It is where this bone, the humerus bone, falls out from the socket. Basically, the ball falls out from the socket. So this leaves with a space at the edge of your shoulder. So there
basically,
are
it means
different
there is
levels.
a mild dislocation, a subluxation that happens
Subluxation
in
of
the
the
shoulder
shoulder, correct.
due to the weak muscles surrounding the
Yes,
shoulders.
correct. And this can cause some pain for the client or for the patient when he or she tries to move the arm.
So speaking of all this, like we were just talking about, if a client is unable to walk, what are the normal exercises that for a physiotherapy would prescribe for these clients?
So as I mentioned before, it would involve so you to walk, you need strength, you need balance. So of course we will see what's the level of strength of the client first.
So if there's a strength issue, you strengthen the muscles.
Yes, so strengthening is quite straightforward. We basically build up the strength in the muscle, doing resistance
But
exercises.
some clients come in with, like, of course, if you would want to strengthen the muscles, there will be certain initial movements of muscle contraction, right? But if certain clients that come in without, movement at all, can we help them?
Yeah, we can. So, like we mentioned before, there are patients who come in with hypotone, which is flaccid muscle. So, times like this, we would use a device called the electrical muscle stimulation, which basically uses electrical current, a very safe electrical current, to stimulate the muscle, because the nerve impulses in our body mimics the movement of electric current. So it would somehow try to stimulate the muscle.
So during the contraction of the muscle, we will also ask the client
to try
activate
to
a certain
move.
part of muscle.
Yes, so that is part of facilitation.
I see. So this will generate something what they call neuroplasticity right nowadays.
Yes.
Can you
So,
explain more about that?
so neuroplasticity will come into play when a movement is done repetitively and very, very high frequency. You're done 50 to 100 times. And this is when the brain cells will start to relearn the movements and form new brain cells, so that the person himself or herself can relearn the movement as well. So that's
50
how.
to 100 times.
Yeah, that's a lot. Some even more. So it depends on how well the client can actually endure. So it's also important for them to slowly build up their endurance, so that they can increase the level of exercises they will be able to do.
So basically, stroke rehab is quite a long process, right?
Yes, it is.
It is a long process. Of course, just now Chris told us there is a 6 month where the golden period where they improve the most. They should actually focus more exercises, be a bit more intense during this period, right?
Correct.
So what would you recommend? How many times normally would you recommend a client to come in?
So since we are trying our best to get the patient to do as much things as possible, as many movements as possible. So of course, 3 to 4 times is a recommended amount of time to come in. But if not so at least 2 times per week, and the remaining time would also be vital for the client or the patient to do the exercises at home, because that's when they spend the most time at.
I think we cannot look down on the golden period, because me and Chris actually we have the experience of seeing clients improve every session, right?
Yes.
When during the golden period where they come in, every session when they came in and they go out, there is a certain level of improvement in the terms of either strength, function, balance. So okay, so speaking of this stroke rehab, right? It's a long process. You've seen stroke clients. Are they very challenging to you, like seeing stroke rehab?
Well, it's more challenging in the sense where some of the strokees can get a little depressed, which is very normal after a stroke. So they would look down on themselves. They would even feel that they are a
Lowered
burden.
self-esteem, right?
Yes.
Some were working before this, and
Correct.
suddenly they got
Some
a
are
stroke.
totally independent, and now they have to depend on their spouse or even their parents.
Some
So
were
it's
breadwinners for home, but yeah, so now their loved ones have to take care of them.
Correct. So it can be very devastating, very frustrating at the same time. But yeah, we're here to let everyone know that it is a very normal process.
Not only to, I think, the clients themselves, but I think during the period of time, even their family members will be slightly depressed, slightly affected by this problem, right?
Correct. So they are the ones who are facing the strokees, or people who are having stroke most of the time. So we only see them for 1 or 2 hours in a day, but they are the ones helping them with their daily activities. They are the ones dealing with all the depression at home, so they can get very depressed as well. So it's important that they understand that it is part of the process, and we will all have to go through it together.
Speaking of flaccidity, right, like really, really weak, clients that don't have balance at all. What happens if the client is so weak that they cannot leave the house? You get what I mean?
Yep.
Yeah. How do physios play a role in this then?
Okay, so there's something called a home visit. Basically, we as physios, we can also go to somebody's house to assess them in their own bedroom or just beside their bed, to understand their condition and to help them do physio.
So you
at
can
home.
basically do exercises at home
as
itself.
well. Correct.
Alright. But are the charges different sometimes in terms that would cost incurred be a bit higher if they were to perform this?
It might be because of the
Traveling expenses,
Yeah.
the time and all, right? Yeah, but definitely we would always advise our clients to try their best to improve, right? Because like I said, stroke is of course very debilitating, but there is always room for improvement, right?
Yes, correct. So do not give up hope when you're feeling that it's difficult. It's very normal to also feel very tired for someone who has stroke, because you require extra energy and effort to perform every single movement, something that is very subtle as just lifting up your arm. So yes, it can be very tiring.
Speaking about just now you told me like if the clients are weak, we do strengthening. What else do a physio do in terms of mobility? We teach them how to first develop some big mobility, right? Like
Yes.
from lying down, how they turn to the side,
So
sitting
bed
up.
mobility that we were mentioning basically includes movements on the bed. So just turning from the center to the left or to the right, or facing downwards, and then followed by sitting up on the side of the bed. So these are movements that
And from then on, if they can stand up and walk, then we will teach them that. But in the case that clients that have not developed the ability to walk, as a physio, you would also teach them to transfer themselves in the wheelchair and
Right.
stuff like that.
Yes, so it depends on the level. Yeah, it depends on the level of ability. So transfer is important for them to get out of the bed and into the wheelchair, so that they will be able to move about at
Go
home.
to the dining table to have
Yes.
their
Yes.
meals,
It's
toilets.
also a form, although you are also relying on the wheelchair, but it's also a form of independence, because you can actually do it on your own and move around the house on your own.
Yeah, so and bed mobility is very important if the clients have to wear their pampers, right? Sometimes,
yes,
when
correct.
they
So-
need it. Like what Chris said just now, prevent big sores and all. Speaking of about wheelchair mobility, we also sometimes bring in the client's family members, right? What are the roles of the client's family members in terms of getting back to where they were?
So family members, are the people closest to
The pillars of the client's life.
yes, they are the people who have, or probably the people who have seen him or her grown up, people who have been with her, like for a long period of time. So naturally, the patient would want support and a lot of encouragement from people that he or she care about. And so moral support is something that people's caregivers surrounding the strokee can provide, and will definitely help with recovery through this journey.
A more personal question, Chris. You've seen strokees for quite some time, right? What are certain memories that really are more fond to you, and during your journey, what challenges are more profound to you in this rehab journey?
Okay, so difficulties will be probably the one that I mentioned earlier on, which is the psychological aspect, apart from the physical. And more fond memories would include one client who just said that he's very grateful for what I've done for him. And basically, at that moment, I was just thinking, I'm a physiotherapist, this is my job, this is what I need to do and what I should do to get you, to move again and to help you with your activities. But he said that, no, you did help me greatly with my life, because now I'm able to go back to work, I'm able to drive to work. And so when I think about that, yeah, maybe I'm, like small things like this can actually make a difference in somebody's life. So that gives me
sometimes
a
we
sense
look
of
down, right?
achievement.
We look down on the things that we do because
We
it's a
take for
daily
granted,
thing. Yeah.
correct. We take for granted for the little things that we do, even by like changing, we don't really like put that
Or
into
walking up the
consideration.
stairs, right?
Correct,
Because sometimes, we try
walking
to avoid
something.
walking up the stairs, but sometimes after a stroke, I think the clients would wish that they could just climb a fleet of stairs or something like
Yes,
that.
some would even feel a sense of achievement by taking 5 steps away from the bed. So yeah.
Or
things like
letting go their hands while
Ah,
standing,
yes.
letting go of their walking aids while standing and stuff like that.
Correct. So we celebrate little achievements like this, little milestones like this, and it also is also a form of motivation and encouragement for them.
Yeah, I understand that you also have clients that recovered quite well, right, from stroke. He went back to diving, something like that. Can you tell? Tell us
Yeah.
more.
So I have a client who was very fond of diving even before he.
He's
had
a young
stroke.
strokey.
40
40
plus,
plus.
40 plus, not very old, middle age. And he
But when he came
used
in,
to when he came
how
in,
was his,
he was walking, but he was limping a little. But his left arm was totally limp. So that was a bigger challenge for me when I was
totally
seeing him.
limp,
Totally limp, zero
Zero
movement. Yes,
movement.
zero movement. To the point
and he was a
where
diver.
he was a he loves diving,
I
so
see.
it's his passion. Even right now, after 2 years of since his stroke, it's been 2 years already. He still talks about diving and how much he wants to go back into diving, and you can see that he's really passionate about it. So I suppose at this point, when he's really improved quite a bit, where he can drive and he can type, on his computer and things like that, his next goal will be to go back into diving. So we will set goals like this for the client to help them to achieve it together. We will find out, like, for example, he has issues swimming because of certain.
But he also had issues driving, right? Initially,
yes, but
his other
now
half had
he's-
to send him to the center, right?
Yes,
To
correct.
driving, or he
correct,
took a
but
Grab or
he's-
something like
correct,
that.
correct. But now
But he's driving now.
independent. Correct. Yeah.
So I think as a physio, other than the training of movements and all, it's also giving the clients the confidence to go back to doing the simple things like driving, making a livelihood from working and stuff like that. But this client that you speak of, I've heard that he went back to diving at one time.
He did try. So because of his wish of going back to diving, he actually asked a friend to help him to slowly get back into the water to get used to his diving equipment and certain diving skills. So that's a start, and he seems very excited about it.
So is he planning a diving trip soon?
Um,
Hopefully
not
this
too
year.
sure. I'm not too sure with the turn of
Hopefully this year.
events, but yeah, definitely soon because he has improved a lot and he's come a
So
long
what
way.
we are trying to say actually, like someone who had a stroke, who suffered a stroke, came in very weak, with a limp arm. There's also a chance for him to rehab and go back to do the things he loves, right?
So it doesn't mean that with a stroke you're disabled for life. As long as you do not give up, you push yourself as much as you can. There is definitely improvement. So it's depending on how much you can improve. But if you have the determination to do it, definitely you'll be somehow you'll be able to do it.
Okay, let's go into more practical things, alright?
Yeah.
In the sense like if someone comes in with a stroke and is unable to, let's just say, walk, how do we train? What do we train?
What do we train?
Mm.
We can strengthen.
So how do you do strengthening? What strengthening do you do?
Okay, we will start with very basic exercises such as lifting your leg,
Straight leg raise.
straight leg raises,
Okay.
holding the straight leg raises if they're able to do it already. So that's how we progress, and then eventually you can
Bridging.
add on. Yeah, you can add on weights.
Okay.
Yeah, bridging is where you lift up your buttocks on the bed, with your legs bent. So that is actually a very important aspect for them to perform before standing up.
Yeah, because I think the glutes or the buttock muscles are one of the most important standing muscles in the body. And most of the time in stroke clients, the glutes will go away first and there will be a lot of wasting, right? Then next it will be their quadriceps, the front of their legs will be,
The front of your thigh muscles.
and also their arms, right? They are unable to lift up their arms sometimes.
Yes.
And most affected are the wrist, right? The wrist component.
So arms would normally recover a little slower than the legs. This is very common. And so fine motor movements such as small movements like moving their fingers can come very later in the recovery period. Yeah.
You were saying in strokies there would also be speech affected, fine motor affected. Can you explain more like what are the physio roles in this and who else does help in all these issues?
So as physios, we work on a lot of big movements, gross movements,
Like lifting the hand,
Lifting the
reaching
arm.
out.
lifting your leg, walking, all these are considered bigger movements. So for them to get back into more skill-oriented or more specific movements, an occupational therapist can also come into the picture to help them, by teaching
Small
them to write.
movements, right?
Yes, correct. By teaching them
Writing,
to write
yeah.
or to unbutton their shirt. Very, very fine movements. So in terms of speech, there is also speech therapy that can aid them with the muscles in their their
In their
mouth.
mouth.
Yeah, for speaking. So it's important that we prevent it by just being careful of the risk factors that we mentioned earlier on in terms of your lifestyle, your diet, your stress levels. We understand that things can be very stressful nowadays in the work aspect, but yeah, just be careful of all this and it will protect you better.
So I think we are done
The
with
end
the
of our
questions.
discussion.
Yeah. So if you would want to know more questions, you have more questions, or you want us to talk about another topic, do feel free to leave a comment below. And I'm Han. We have Chris.
Chris.
And, yep. Thank you.
Thank you for watching.
Tuning. Yep.
See you the next time. Bye.